On July 7th, 2010, my twin brother sent me a suicide note. Fortunately, he didn't go through with it, but a couple months later, he ran away. Fast forward 3 years later, I'm reunited with my brother, but he's near his deathbed. Turns out my brother contracted HIV, and he denied treatment and his family as a result of the shame, stigma, and confusion. This, in turn, led to severe AIDS and many complications, medical complications, mental health issues, treatment regimens. The list is a huge burden. But if there's a silver lining here, it's that this experience inspired me to produce a product and a project that will help other people, which is why I am so excited today to introduce you to LivPoz, an app that helps people positive with HIV manage their health care and their self-care. My team and I have been working on this project, and we are comprised in backgrounds of ranging from business, entrepreneurship, computer science, health, research, design, and psychology, and awesome stuff. But here's what we know. Worldwide, there's 35 million people living with HIV, and there's 2.1 million new cases each and every single year. In the United States, there's 1.2 million people living with HIV and 50,000 new cases per year. And if we zero in even more, in the state of Michigan, there's 20,000 people living with HIV, and 66% of that number is located in Southeast Michigan. Here's some points. 30 to 40% of people living with HIV do not adhere to their medications properly. In fact, only 6% adhere to their medication, over 95%. Why is this important? Because adherence is literally a matter of life or death. With LivPoz, we're going to help positive people that live with HIV, manage their medications and adherence, find a path towards wellness, gain confidence through education, and promote their well-being, which is proven to reduce the adverse effects of HIV medication. If we look at our features, LivPoz provides medication reminders and color-coded system to understand drug interaction information. We have the most up-to-date, scientifically sound resources right at your fingertips. Stats show that you're more likely to reach your goals if you track your progress, and with LivPoz, you can do that. In addition, science also shows that if you have a positive outlook on life, you get sick less often and you recover faster. So with that said, we're using evidence-based wellness techniques to help people with this process. Always stay in direct contact with your healthcare providers and your support network with our contacts, all in one location within the app. In addition, with LivPoz Social, you can connect anonymously with other people living with HIV to share stories, encouragement, and pass along information. Here's the thing. We looked at the competition, but we're not impressed, okay? They're bare bones, they have limited features, and of the few features that they do have, it is not person-centered. There's no humanistic quality to it that builds empathy and emotional connection. With that statement, I'm going to pass this over to Ryan to talk further.
Thank you, Maria. So in building a social enterprise, first and foremost, we need to understand that if we're going to serve anyone, we need to understand how to sustain ourselves. So to address that issue, we first ask who else is invested in our success. As you can see, there are a great number of people. So with so many players, the million-dollar question is, who pays? We've investigated over the past 6 months a number of business models, and in speaking with users and industry experts, we've narrowed that down to 3. We intend on pursuing 2 to begin with, and then on down the road, once we've built capacity, the 3rd one. The first is partnering with pharmaceutical companies and other for-profit research organizations who would stand to benefit from access to large sets of de-identified patient data about who's using their product, when, how, and what their experience with it is. The second partner is health publishing organizations such as WebMD, Healthline, Everyday Health. These companies produce scientifically sound, meaningful content that our user base is wanting, needing, and actively seeking out. By embedding that curated content within our app, they have access to it, and it drives our user base to their site, which generates ad revenue for them. And then finally, partnering with providers themselves once we have built marketing capacity and a solid user base. Our app allows us to connect patients with their treatment team and in order to ensure that their care is on target and effective. All right, so our addressable market. There are, as Maria mentioned, 35 million people living in the world with HIV. While we would love to be able to help all of them, with LivPoz, we are only targeting those with smartphones, which is approximately 1/3 of them. And we believe, we estimate that we could reach 1% of them. We intend to reach them by partnering, by cross-promoting with established brands, one of which we have already established a connection with and have received positive endorsement through. And the other way is by partnering with healthcare organizations, so doctors can prescribe this app at diagnosis and follow-up. All right, so this is year one, day one condition, one app. There is no reason that a similar model couldn't work for any number of other conditions. So while we give life to LivPoz, we're looking forward about how can we scale this to other conditions that have populations that are in need of support. So what will it take to get from here to there? First, we need office space and equipment. We need the essential services to run it. We need to purchase computers, phones, hosting services, and security clearances. We need to hire the talent beyond the 5 of us here. This would primarily include engineers and a marketing team. And then we need to establish the channels that will bring it to life. All right, so in the past 6 months, we've learned a lot. The chief lesson among them is get outside the building and talk to people. And we are eternally grateful to the many mentors who have provided us their time and insight and wisdom over these months. And we look forward to continuing the conversation with them. So going forward, we intend to further develop this app, conduct more UX research, and continue to make use of the wonderful resources here at the University of Michigan.
Let's go back to 2010. What if my twin brother was handed the LivPoz app right at his diagnosis? What if he had a support network and tools to help him move forward and just be a click away from resources? With your help and support, we can make LivPoz happen and eliminate that question of what if. Thank you.
Thank you.
So guys, great work, great presentation. One of the key things is, again, compliance with meds, as we talked about. But how about compliance with the app? So tell us why folks, once they start, if they buy in, are going to continue to use it, and how's it going to be sticky over time that'll help their care?
Yeah, so that's a tricky part. And one of the things that we're trying to integrate with our app is the emotional aspect of it, so you're emotionally connected to it. So one of the things that with our competition is very focused on the medical part of it, just the kind of scary part of it. And so with our LivPoz Social and the different features that connected with wellness, we're trying to build some kind of reward system that keeps them coming back and staying motivated and connected. So we're trying to build an emotional connection with others. And that's the thing that helps people move forward.
In the design, we've also included elements of personalization. So you notice at the end there that photo changed. And so users can upload their own photos as well as their own quotes and things that are keeping them going.
It'll be a simple question. Actually, it's a simple yes or no answer. So let's say I could introduce you to people in what I think is the greatest city in the world that has agreed to tackle HIV management on behalf of a distressed, fragile, economically disadvantaged population. Would you accept that offer to meet with decision makers in this city, representatives of hospitals, health systems, health plans, and introduce your solution to tackling this problem?
Absolutely.
Do you want to take this?
Absolutely. Absolutely. One thing that we have started to think about is moving forward, how can we reach those people who may not have a smartphone? And the key to that would be to build an infrastructure around the smartphone itself. So some stuff that we've brainstormed so far would be to find a way to be able to hand those individuals a smartphone. And based on their usage of the app, perhaps minutes are added to the phone or data is added to the phone. So and for the record, it would have nothing to do with whether or not they're adhering, no judgment on our end, simply using. And in that way, we would be able to build a type of model to incorporate those people into this process and to take advantage of the app.
That was a great presentation. Congratulations. Is there an app that maybe in a adjacent venue that has the features that you would like to emulate? Any others?
Currently, right now, there's nothing really out there, which is why we decided to step in. All the other HIV-centered apps, the few that are out there, if you type in cardiovascular disease or diabetes in the app market, you'll get thousands of hits. You type in HIV, and you get very few. And the ones that are there are so bare bones that it's nothing that you couldn't already do with your own smartphone by programming reminders in there. And the general information, too, is nothing that you couldn't pull from any website online.
Yeah, I want to note that our project is focused on a mobile app. So while there are other tools out there in the web, desktop websites, for example, Patients Like Me, that's desktop, it's not mobile. Nobody wants to go to a desktop at a desk and interact with something. So by having an app, you have this connection with you all the time. And that's one thing that we're trying to do.
Thank you.